Okay, yes. Okay, how many reviewed the best technique? And I wanted to know feedback on what you thought about it. Did you do it yourself? Did you try it, then revert to Plan B? The last group, we kind of did all of the above. So speak to me. Tell me what you did. I hope you tried it.
I tried it and went back.
You what?
I tried it and then went back.
You tried it and abandoned it. Okay. Anyone else?
I keep trying to try it.
Yeah.
Yeah, I keep doing that.
No,
No, I
what?
do start off. It just does, like
Yeah.
you said, it takes a lot of time. So
It does. It takes a lot of time. I find in my own mouth what I do is the first thing I do, and I've been working on this a long time, okay? But I definitely do the best technique. Then I go back because I know where my problem areas are. And sometimes I'm just not sure, you know, if I'm getting it. So I'll go back and usually, but I use a really soft toothbrush, really, really soft. And I don't overthink it or overwork it. And so I go back and I really just kind of slowly go to my problem areas and just make sure that I've got them. Because the bass is difficult, and sometimes it feels like, am I really accessing that sulcus with the bristles? So I know where you're coming from. But truly, to be able to do each other in this PE, and whether you're the patient and your clinician is asking you to show them, because you will disclose each other, you will have to remove it with the bass technique. And if you're not practicing that, you know, we kind of can tell, because it's, as you know, when you practice, when you go in there to do the linguals, you know, sometimes you're feeling like, are my bristles pointed the correct way? Am I doing this right? So you really need to be proficient at it so that you can be a good patient and so that you can teach your patient, when you're the clinician, the proper way. Because, you know, if you're stumbling around with, you know, which way do I come up, it kind of shows. So keep at it. You know, I don't know what techniques you're using. You're the one that knows what your relationship with your dentist is and what kind of report card you get, whether you're decay-free and plaque-free in your mouth. And if you're accomplishing that by doing circular brushing and everything looks hunky-dory, then you're fine with doing that technique in your own mouth. As we talked last week, I don't change techniques if they're plaque-free and there's no instance of trauma or disease. I let people continue to do whatever technique they're doing. But if there isn't in your own mouth, you might want to give this a try. But certainly, at the minimum, become comfortable with this technique in your mouth, because you do need to know how to teach it. It is supposed to be the best technique. And I agree with that, but I think we all kind of shake it up depending on what's going on in our own mouths. So did any of you disclose, use the disclosing tablets? No one did?
I have way too much composite in my mouth. I don't know what
Okay.
it's doing.
Yeah, well, you will have to use it, composites or not, when we do the PE on one another. You know, you can cover those areas, you know. And you know what, really, the disclosing stuff is going to come out. It's not going to hurt anything. So please, it's always interesting when you guys are practicing next week on each other and the week after that, because I think everybody's shocked at how much plaque shows up. Now, you know, people say, well, I just ate a little something for breakfast. I haven't brushed since I've gotten here. That doesn't matter, because that plaque is not showing up based on what you ate that day. It's showing up because you didn't remove the plaque in the 24 hours. You know, if you, 24 hours ago, completely remove every speck, and none of us do that, it's going to show up, you know, in the next 24 hours, whether you ate or not. So, you know, you'll find out soon enough, you know, where you're missing, because you'll be practicing on each other, and that's fine. But it is a good little tool, you know, to try at home. Any questions about the technique before we move to flossing, or about anything that you learned about your technique, or what you wondered about what I showed you last week? Any questions at all, or feedback? Do you guys not want to be shown on a movie? No. So, okay, are you sure? Because anything's fine. You know, there's no right or wrong comments or answers here. Okay, so flossing. Did you try the technique that we showed last week? And did you floss? And, okay, tell me what you learned, how you felt, how difficult it was.
It's harder for me.
I flossed
Yeah.
like that already.
Do you?
Yeah.
Okay. It does take longer to do it correctly, hands down. I mean, my husband is always making fun of me because he says I spend 10 minutes, but to floss correctly, to see it around, I was flossing once this week, and, I think I know what I'm doing, but I mess up too. I'm there, I'm like, wait a minute, you're not seeing it, you're not bringing it around, and it shows. One of the students in the other class talked about when she was brushing and then following up with the disclosing solution, she says, I've got a couple of cuspids that are rotated, and maybe some of you have like a tooth that's lingual, that sits back. You might have a tooth that sits more in front. So when you're brushing, it's almost like you have to do those separately, especially a lingual one, because when you're just brushing normal, you're missing that tooth that sets back. I've got a cuspid that's really rotated, so I have to, after I've brushed, I have to take my brush, and I have to do just that tooth, and I kind of got to bring my brush around this way and really get it, because I think I'm getting it like crazy, and I'll look in the mirror, and I'm missing it. So when you have a deviation from nice straight teeth, it's you're going to show up plaque on the disclosing solution almost assuredly, because it's hard to get those areas. So keep that in mind. And those are special areas that we need to tell our patients, okay, you're doing good, but this tooth sits back. Here's what you need to do there. Maybe you need to do this, and you just need to take that one tooth and do it. So there's so many exceptions to the rule. The flossing, it's difficult to do it right. It takes time. Your gums are bleeding. Maybe they're sore. But if you stick with that, it really, you'll get it. You'll get it. It becomes quicker. I'm not going to say it's ever going to be really quick, because to do it properly takes some time. What other comments did you have about the flossing? Did you find it a lot harder to do? No, not really. How about the doing it on your middle fingers? I know so many of you are used to wrapping around your pointer fingers.
Yeah.
What did you find?
It's harder to get to my back teeth a lot.
Yeah,
Harder.
it is. Well, you know what? I was kind of paying attention to what I was doing, and I found myself doing what I told you not to do. I always do the middle fingers, but in some areas I could see where I pinched and just didn't do one, to help me maneuver. Those back areas are really hard, and honestly, I could tell you what to do, but it's trial and error, and practice makes perfect, definitely. Just when you let out more floss, the one thing that's really important is that, so when you're working on the front teeth, you're more like right there. So when you're on the back teeth, to get back there, you're letting out more floss, but if you don't really stretch a finger or a thumb to make that still, that area that you're working with needs to be small and tight. So if you're like that, you're not going to have any control. But if you move this thumb or finger further and you've got that small little area, you reach back, you're still getting back there, but that area's still got to be pretty small with where you're working. It is, you can read about it in Wilkins. I can tell you what you need to know, but until you do it and you figure out in your own mouth, it doesn't make sense until you're, on the job with yourself trying to do it. Again, you can't teach and be authentic unless you're really doing these things in your own mouth. If you're telling your patients you really need to floss every day, once a day, and we need to be telling our patients that, and you're not doing it, there's a huge disconnect. So keep working on it. It's a work in progress. What you've told me with where you're at is what I expected. It doesn't happen overnight. So just keep working on it. Any more comments or questions about the flossing and anything that we talked about this week that didn't make sense, that was hard to do? We're all good? Okay. You can stop.